Hi, good afternoon, everyone. My name is Sharon Daniel, and I'm one of the member of Group 5. I'm the student of PMHNP program at Colorado State University, Pueblo, and we're going to talk about transcultural nursing theory for our poster presentation. I'll be discussing about the autobiography of Marilyn Linger and why she has created this theory. Marilyn Linger was born on July 13, 1925 at Sutton, Nebraska. She died on August 10, 2012 at the age of 87. She was the founder of the theory of transcultural nursing or cultural care theory. She was the former CEO of the American Association as well. She was the living legend of the American Academy of Nursing. She is considered by some to be the Margaret Mead of nursing. She defined nursing as a learned, humanistic, and scientific profession and discipline which is focused on human care, phenomena, and activities in order to assist, support, facilitate, or enable individuals or groups to maintain or regain their well-being in culturally meaningful and beneficial ways, or to help people face handicaps or death. She was the middle child of 5. She had 2 older sisters and 2 younger brothers. She graduated at Sutton High School in 1942. She entered St. Anthony's School of Nursing in Denver, Colorado. She was the member of United States Army Nursing Corps as well. Now I'll be discussing about her awards and achievements. In 1948, she graduated from St. Anthony's with diploma in nursing. In 1950, she earned a bachelor's degree from Mount St. Scholastica College in Atchison. In 1951 to 1954, she studied biology, nursing administration, curriculum, and teaching at Creighton University in Omaha, Nebraska, which was the equivalent of Bachelor's of Science in Nursing. She received her Master's of Science in Nursing in 1954. In 1954 to 1959, an Associate Professor of Nursing in the Child Psychiatric Nursing Program. In 1955 to 1958, she studied nursing curriculum and the social sciences at University of Cincinnati. In 1960, she began her doctoral studies. In 1966, she received a PhD in cultural and social anthropology from University of Washington. She was the first nurse to achieve this honor. In 1966 to 1969, after receiving her PhD, she joined the faculty of University of Colorado, where she taught in the College of Nursing and the Department of Anthropology and was the Director of Nursing Scientist Program as well. In 1969 to 1974, she was the Dean and Professor of Nursing, lecturer in the Department of Anthropology at the University of Washington. In 1974 to 1981, she held various positions at the University of Utah, including Dean and Professor of Nursing, Professor of Anthropology, and Director of the Center of Nursing Research and the Doctoral and Transcultural Nursing Program. She established the Transcultural Nursing Theory. In 1981 to 1995, she was the Professor of Nursing, Professor of Anthropology, and Director of Transcultural Nursing Program and the Center for Health Research. In 1995, she is semi-retired. She was still very active in teaching and promoting her work. In 1998, she was named as a living legend by the American Academy of Nursing. Now I'm going to talk about the overview of the theory, Transcultural Nursing Theory. The Transcultural Nursing Theory, or Cultural Care Theory by Marilyn Linger, involves knowing and understanding different cultures with respect to nursing and health, illness caring practices, beliefs, and values, with goals to provide meaningful and efficacious nursing care services to people according to their cultural values and health illness context. It also focuses on the fact that different cultures have different caring behaviors and different health and illnesses, values, beliefs, and patterns of behaviors. The main focus of linear theory is for the nursing care to fit with or have beneficial meaning and health outcome of people of different or similar cultural backgrounds. In 1995, Madeline defined transcultural nursing as a substantive area of studies and practice focused on comparative cultural care, values, beliefs, and practices of individuals or groups of similar or different cultures, with the goal of providing cultural specific and universal nursing care, practices in promoting health or well being, or help people to face unfavorable human conditions, illnesses, or death in culturally meaningful ways.
Good evening, class. My name is Jerusalem. For my part, I'll be covering our literature review. Before I get into the literature review section, I'd like to share about some of the unique features of Madeleine Leninger's theory. Her theory is one of the oldest theories of nursing. It focuses on interrelationships of culture, care, well-being, health, illness, and death. Also focuses on comparative cultural care. Its holistic and multidimensional exploration of culturally based care, meaning, and practices. Also seeking to discover the cultural care diversities and universalities. For our poster presentation, our group looked into 8 articles. We searched our articles mainly using CSU library resources, CINAHL. We also looked into PubMed and Google scholarly articles in Google Scholars. We presented 4 articles on our poster. Each article did a very good job explaining the founders, Madeleine Leininger's transcultural nursing theory. Although the areas, the setting, even the countries of the study differ, in their findings, these articles all pointed out the cruciality of transcultural nursing. Some of the findings include Madeleine Leininger's theory of transcultural nursing is the key to providing consistent, comprehensive, and quality services in a diverse setting, such as the United States. Another article pointed out nurses to be aware of the importance of nurses to be aware of cultural differences in healthcare. Aligning nursing care and patient care plan with the patient's culture in order to provide trust and effective outcome in patient care. One of the articles also pointed out the importance of including courses on this topic, transcultural nursing education program, attaching a high importance of foreign language education, and also enforcing regulations that are more conducive to cultural interactions. You can find all our literatures at the bottom right of our poster. Thank you.
Hello everyone, my name is Miriam Bawazi. I'll be talking about Madeleine Leininger's transcultural nursing theory, especially its application to the nursing practice. I will give a case study. Mrs. H is an immigrant from Africa who moved to the United States a few years ago. She lives with her daughter and her grandchildren. She's the one usually who cooks meal and takes care of her grandchildren while her daughter works. For the past few months, Mrs. H has been experiencing weakness, fatigue, with increased thirst. She did not think anything about it besides that she was tired. One particular morning, Mrs. H slipped on her kitchen floor and bruised her right leg. When her daughter heard about it, she took her to the urgent care. At the urgent care, her random blood glucose was 400 and she was diagnosed with diabetes type 2. Mrs. H denies loss of consciousness. She also denies taking alcohol or any type of drug. Her vital signs were normal, besides, of course, her blood sugar, which was elevated. She was prescribed a medication to lower her blood glucose, which was metformin. Mrs. H, who does not speak English, and her daughter translated that she needed to take the medication, she insisted that she should first try herbs from her country because she believes they work better and there is no side effects. The nurse, who understands that incorporating a patient's culture and preferences increases patient outcome, she advised Mrs. H to bring her herbs once she gets them from her country so they can go through education with the provider and see if there is any interactions. Mrs. H agreed to continue taking her medication and to bring the herbs once she gets them from her country. This shows that the nurse advocated for Mrs. H and her care, while she also took into consideration that Mrs. H culture uses herbs without denying her preferences. This shows also that incorporating transcultural nursing and being a culturally competent nurse helps with patient outcomes and helps patient trust the nursing and healthcare profession better. This is the end of the video. Thank you.